Okay, now we'll turn to our third objective of how can we support older adults experiencing loneliness and social isolation. So here we're going to think about opportunities to meet these needs in public health and clinical settings. This is a huge area of national conversation right now, and in large part due to the Surgeon General Advisory, which came out in May of 2023, which detailed our epidemic of loneliness and isolation. And here, Dr. Vivek Murthy's office called for action in this space and really cross-sector collaboration. And here are six pillars to advance social connection that they outlined in their report, including strengthening local infrastructure in the communities, enacting pro-connection public policy, mobilizing the health sector, reforming digital environments, deepening our knowledge, so just kind of spreading awareness about what's going on, along with coordination, and then building a culture of connection. And I really like this cross these six pillars because it encourages everyone to have a seat at the table as we try to tackle these broad societal challenges. I also like this conceptual framework that has been proposed by Dr. Julianne Holt-Lundsted, which was basically the major author of that Surgeon General report and has done a lot of the really paradigm shifting work in this space. This framework incorporates two different ideas. The first is the social ecological framework, which recognizes that there's different levels of policy change, health related interventions that can impact ultimately the person in the center here, the person, the socially connected human, as is referred in this figure. So, kind of these interpersonal factors, organizational factors, community level factors, and then society level factors. This framework recognizes the interdependence of many of the social determinants of health. And so if you can improve people's food security, that might be able to impact people's social connection. I mean, you can imagine, right? Communal dining, Meals on Wheels, these kind of food delivery programs actually foster social connection. And then the third thing that's incorporated here is the lifespan approach, thinking about different life stages, the importance of diversity and equity as we address these intersecting factors, and the need to generate evidence, both kind of efficacy as well as effectiveness evidence as we're applying interventions. From the article, she also breaks it down even further to these intersecting factors at all of these different levels. And so you can imagine that we have a lot of evidence in some of these sectors, some of these intersecting factors, but we may have a ton more opportunity or really a dearth of evidence in some of these other factors. And so this can help when we're thinking about interventions. Where does it actually fall here, and what are the opportunities for synergy? Okay, so I'm going to outline three different broad opportunities to just help us start thinking about where we can make a difference in this space. The first is a general kind of cultural challenge to prioritize human connection. So, I'll just point out that there's a lot of structural barriers in our health system that can impact people living with dementia. Um, some of these things came about from the COVID pandemic, things like visitor restrictions in the hospital, infectious precautions. Some are just a part of our health system, things like jargon, handoffs and fragments of the healthcare systems, the lack of time that we provide to include caregivers. These challenges all respond to human connection. And so, in our health system and many other models, we just have to resist some of these structural barriers that and try to normalize inclusion of human connection in our processes. And there's a number of successful models in health systems. For example, pediatrics is a great model for, thinking about the whole person and trying to prioritize social connection. A second aspect of this is within our communities. So, you know, we we have to work against some of the cultural challenges in our systems to build community in our discipline, across discipline, foster conversations when we're doing that, and really build social infrastructure and community. You know, I really start by thinking about the time that we spend with others. You know, we don't have to quit our jobs and only spend time with our friends, but if we start with 15 minutes a day of high quality time without distraction along any of these levels, or discipline, across discipline, trying to build social infrastructure in our community, I think it can really go a long way to normalizing human connection throughout our lives. Okay. A second area that we have great opportunity is simply by identifying loneliness and isolation and processing emotion that people are going through. So, isolation and loneliness often come with significant life events, the death of a spouse or family member, changes in living situations, a serious illness. Many of us can point to specific times in our life where we felt lonely or we were in a really isolated space. The pandemic, what really brought this to surface for many individuals. And so when I encounter experiences of loneliness and isolation in my clinical practice, there's always a temptation to try to jump to a fix, but we can do a lot by just sitting with those emotions and helping people process what's going on, kind of sitting and holding space. So I'll often try to think about what might have led to those experiences, or ask people kind of what's going on in your life that has kind of brought you to this place. I use a lot of communication techniques to help process emotion. There's a framework that we use in clinical practice called the NURSE framework, which is a way of listening to emotion without trying to fix the emotion. And it stands for name, understand, respect, support, and explore. And then asking people if they want help in addressing this need. Not everyone wants, their friends, family, clinicians involved in their social life, but a lot of people do appreciate when people are involved. And so I often ask for an invitation. Some of the language that I use to get at these topics are, I've noticed that many people have been feeling lonely recently. Is that something you have experienced? Really to try to reduce the stigma that's associated with these concepts. And then, do you need help connecting with others? Can be a much easier way to broach these topics. Okay. And a third opportunity I'll present here is the opportunity to work across disciplines and sectors. And this was brought up by the Surgeon General report. As a clinician, I'm always thinking about what are the health system approaches that we can take. But part of this is, just trying to improve collaboration and working across silos. So in the health system, for example, we might be able to address social needs through medical contributors, vision and hearing loss, functional impairment. If people are experiencing pain, incontinence, or depression, that might all present a barrier to their social lives. Other disciplines like psychology, chaplaincy, social work, art therapy might address social isolation and loneliness in a different way. Dignity therapy, art therapy, meaning making, or trauma informed care are all evidence based approaches. And then community organizations and policymakers can do a lot, of course, to enhance social connection. So there's an idea called social prescribing, which has gained a lot of traction outside of the US. UK and Canada, Australia are some of the exemplar nations that have started to build in this approach to the health system. But this is an idea of health systems actively participating and making referrals to community organizations with expertise and awareness of programs to enhance social connection. And this really is grounded in the idea of cross-sector collaboration to meet people's social needs, whether it's the structural or functional or quality aspects of their relationships. And we can discuss this more in our live talk. So in the San Francisco and Bay Area, I have the giant table here on the right-hand side. We've identified nearly 60 different organizations, 60 organizations that have addressing social connection as at least part of their mission. But none of these programs know about one another often, and many are not connected to the health system. So when we're thinking about social prescribing, really the goal here is to connect people that we're seeing in the health system to these great programs that are already available in our community and individually tailor the programs to people's needs. So some of the programs we've worked with, for example, involve peer support, intergenerational programs, telephone support through companionship lines, exercise and group classes, volunteer opportunities like Experience Corps, which is similar to AmeriCorps in the US. And lastly, a quick word on where does technology fit in? Is technology good? Is it bad? Should we all be talking with chatbots? Should we all have robotic cats and dogs? Where does virtual reality fit into this, right? There's so many different questions and potential technological solutions here. And my answer is it depends. So I like this framework from Waits and Gray from 2018. They said that online technology can benefit connectedness when it complements already deep offline relationships. But it can impair connectedness when it replaces those deep offline relationships with superficial online engagement. And that's where a lot of the criticism of social media, especially in adolescence and youth, it comes from. A third possibility, though, is that it can enhance connectedness when deep offline engagement is difficult or impossible to attain. And I think about this a lot with caregivers of people with dementia who may have a hard time getting out of their home or connecting with others with, a shared caregiver background. Learning technology is really important, though. It's critical to think about equity and inclusiveness as we have new technological innovation, because older adults tend to get left behind. So, some of the key pieces that we learned from the pandemic are that older adults want to learn, that we need to actively address ageism when we think about technological innovation, both in terms of access as well as the ability to learn. And that group classes can be beneficial, right? It just kind of normalizes the experience, and it can be fun, and promote social engagement. So, with that, um, thank you for listening to this lecture, and please feel free to reach out if questions come up.